I think that it takes kind of the right kind of person who really enjoys working with other systems, other hospitals, who really enjoy working with clinicians in other settings and community settings where there, is not a lot of neurology, if at all. And so I think a couple of things, really work on your shared leadership skills. You really want to work with these hospitals. Most of the time they have their own kind of vision and mission and protocols and resources. Every hospital has different resources. But ultimately they all want to, do what's best for the patient. And so I think it's important to really learn how to lead with the leaders of those spoke sites or those community hospitals that you're working with, whatever your structure is for teleneurology or telestroke. So really work on those shared leadership skills and really get to know the sites once you're in that kind of position. Really see them as individual, almost like characters in and of themselves as a site, and of course the individual people who are leading at those sites. Mentorship is important. There are, Telestroke has been around since the 1990s, but there are still a lot of nuances, and especially with, changes in technology and policy and so on, it's hard to keep up. And so, even if you have your foundation from training, if you're fortunate to have it during your training on Telestroke or teleneurology, then going forward, you want to make sure you're connected with people who understand what you're going through, who maybe have solved some of the problems that you're experiencing, who you can network with on projects perhaps, or, dissemination of your findings and so on for any of your research or QI projects. So mentorship is important. There's a whole Telestroke community out there. And then I think that it's important to also kind of stop the sort of outside hospital stigma that we tend to have. These are hospitals that are, yes, patients come in with all the imaging that you want, but they're sending the patient to you for a reason. We grumble a lot about not having all the information we need from the outside hospital, but they're doing the best they can with the resources that they have. So I think kind of you have to really get rid of that stigma. And really see, okay, what are their resources and how can we help them? How can we help each other? And then I think also to make sure you focus on quality, not just access, but quality care for these patients. I think those are the important things to keep in mind for a career in telestroke and teleneurology. So.